Welcome to the Evolving Past Alzheimer's podcast, where we are focused on bringing you information to help prevent and reverse brain diseases like Alzheimer's and other dementias. I'm Dr. Nate Bergman, a functional medicine physician in Cleveland, Ohio, and your host on this journey. So, whether you're a baby boomer who's worried that your brain wiring just isn't working like it once was, or you have loved ones with the disease, or you yourself have already been diagnosed and are wondering, what do I do now? You'll want to listen to this podcast. Each episode, we introduce you to the top doers and thinkers that are revisioning Alzheimer's and dementia. If you have questions or comments or just want to connect, please check us out on our Facebook page, or if you're old-fashioned like me, Google Evolving Past Alzheimer's Podcast, and you'll find us that way. So here we go. Let's get better. Welcome back to the show. Today, we have another real special guest, Dr. Scott Sherr from San Francisco Bay Area, where he works both as a hospital medicine physician as well as operates his own independent hyperbaric oxygen practice. He's also the director of integrative hyperbaric medicine and health optimization with Hyperbaric Medical Solutions. Welcome to the show, Scott.
Thanks for having me, Nate. Happy to be here.
Yeah, I became recently kind of smitten with hyperbaric oxygen. I think it's abbreviated as HBOT. I've heard so much about it for so long, and started to, some people that had influenced my thinking started talking about it, and we met, and I thought, wow, what an opportunity to have you on the show.
Well, I'm excited that you're smitten with hyperbaric oxygen therapy. I don't think anybody's ever described their relationship with it as smitten. But if I had to go back and think about my relationship with it, I would have to agree with that descriptor. I think there's so much about this particular therapy that I latched on to quite quickly. And I think what it really came down to was just the simplicity of it, because I'm not a complex guy. And so I was really excited to learn that it was just two things. It was just oxygen and pressure. And when you combined increased atmospheric pressure with increased oxygen that you inspired, that you breathe, that was all you needed to do to have this gigantic effect on the body. And then I was smitten. I was smitten, Nate.
So is hyperbaric oxygen like a new thing, or it's been around for a while, right?
Well, yeah, we've been pressurizing air. So the air that we're breathing at sea level right now, most of us that are at sea level, only has about 21% oxygen in it. Now, you go back until, I think it was actually the 1660s or somewhere about there, where they started sucking air out of enclosed chambers, and they were then pumping air into enclosed chambers. And they were actually seeing how those effects changed people's physiology without having a whole lot of biochemistry known at the time. So even back then, we knew that if you took air out of a room, or you, like a vacuum, for example, or you actually pumped air into a room, it actually changed how people felt. And it wasn't really until the late 1800s, early 1900s, when oxygen was discovered, maybe a little before that oxygen was discovered, but it was also the building of bridges, like the Brooklyn Bridge, for example, in New York City, kind of close to where I grew up, but I grew up in a suburb, not a city person myself, although I like New York City. And the Brooklyn Bridge was built in the 1880s, and there was this thing called the bends described, or the Grecken bends is the full name. Basically, these people would, so that was really how hyperbaric therapy became known or understood as a potential way of recompressing people that had decompression illness. And it was invented and put into chambers so people that were on the surface of the ocean could go into these chambers to get recompressed, basically simulating the pressure that you would feel if you were under a certain amount of seawater. And it wasn't until the 1950s or so that it was starting to be used outside of decompression illness. And it actually, one of the first indications or reasons it was used was actually in patients getting cardiac surgery. You'd actually compress an entire room, and you would actually operate under a compressed chamber environment. And when you did that, people had better outcomes, because even when you compress air, room air or sea level air, with pressure, so you pressurize it, you're actually increasing the amount of oxygen in circulation. And so it was really during that time, during the 1950s, and after that, the sort of the modern hyperbaric oxygen therapy world came into view.
Okay, interesting. So it's basically forcing hyperbaric oxygen, which is again abbreviated HBOT, as I understand, is forcing highly concentrated oxygen using pressure, and it essentially is healing wounds. And we'll get, I'm sure, more into that as we move forward. I think it's important because most of our listeners are sort of focused on brain preventing, reversing Alzheimer's. I think it's important to distinguish between FDA approved uses for this and then those that you might call investigational uses. Can you just kind of briefly run through what the clear indications for which insurance will pay for and what might be more considered investigational or uses?
Yeah, sure. No problem, Nate. Just to kind of follow up on one of your points about what hyperbaric therapy does. In the end, what they realized back in the 50s and 60s is that really hyperbaric therapy does three things. It reverses hypoxia, so it decreases or improves oxygenation. And the second thing it does is decrease inflammation. And the third thing it does is fight infection. So it was very basic bench work done in the 50s and 60s and now, even now, where we're looking at how hyperbaric therapy really works on the macro level. But in the end, it does heal wounds no matter where they are, and including the brain. And right now, hyperbaric therapy is FDA approved, so it's insurance coverable, Medicare, commercial, for 14 different indications. The most common indications that we see are diabetic foot ulcers, so patients with diabetic foot wounds and have diabetes, obviously, that are non-healing. Those that have had radiation injury from cancer treatment, so they've had radiation to their prostate or to their breasts or to their brain or their head and neck for head and neck cancers, and they've had side effects because of those radiation injuries, because of radiation that can cause injuries to the tissue, I should say. The third one that we see is chronic bone infection, so osteomyelitis of the bone, super rough, and hyperbaric therapy combined with antibiotics can be very effective for those. Another one is called sudden sensory neural hearing loss. These are patients that have a sudden loss in their hearing, and we think it's probably either a viral illness or some sort of hypoxic injury to nerve cells. But hyperbaric therapy, especially when used very quickly after the symptoms begin, can be extremely helpful in helping reverse this and help people regain their hearing. And
so let me just jump in. Hypoxia, just to define it, hypoxia, we've used that term a couple of times. That's a low oxygen state, correct?
Yeah, so hypoxia is low oxygen. Hyperoxia is a high oxygen state. So hyperbaric therapy reverses hypoxia by causing an increased amount of oxygen to be actually allowed to be into the bloodstream. And it does that, to take a quick sideline there, it does that not through the red blood cells. So typically red blood cells are what carry oxygen from our lungs, where they get oxygenated when we take a breath, to the rest of our body. But most people have normal lungs, and most of those red blood cells are saturated with oxygen without you needing a hyperbaric chamber to help you. So where hyperbaric therapy actually exerts its effect is actually by increasing the amount of oxygen that's diffused into the plasma of the blood. And the plasma is the liquid of the blood. And the plasma has very little oxygen in it at baseline, at sea level. And it has basically infinite amounts available to it to diffuse oxygen, in the sense that you can diffuse a lot of oxygen into the plasma. And that's how hyperbaric therapy works. So it actually bypasses the red blood cell. And in fact, you can get so much oxygen into circulation at about 66 feet of seawater equivalent, because all this medicine comes from diving, as we talked about decompression illness. At 66 feet of seawater, you don't need red blood cells anymore to transport enough oxygen to circulate throughout your body and do everything that you need to do. So they did some experiments back in the 50s on animals looking at this. And it's actually one of the indications, to go back to that, for hyperbaric therapy in the acute setting and the traumatic setting is severe anemia. So patients with severe anemia can be put into a hyperbaric chamber temporarily, or if they're a Jehovah's Witness, for example, they can be put in there to give them or buy them some time. So
Jehovah's Witness, obviously, because they won't accept a blood transplant typically.
Yes, indeed. Yes. So some of the other more traumatic or acute reasons hyperbaric therapy can be used and are approved, something like carbon monoxide poisoning or thermal burns from fires, for example. Another one that we don't see very often, unless you're maybe in Russia, is cyanide poisoning. But we don't see too much of that. necrotizing fasciitis, which is a flesh-eating bacteria. It's a pretty nasty infection. And in fact, it's the first indication that I saw treated when I was training at the University of Maryland in Baltimore. But phenomenally effective for that, because hyperbaric therapy, like I mentioned, is reversing hypoxia. So it's allowing oxygen to get to tissues, and it's also fighting bugs, so fighting bacteria, and especially bacteria that don't do well in high oxygen environments, like the ones that cause that particular illness.
So those are the FDA approved indications. On the investigational indication side, what do you see on that side?
Yeah, so there's a good cadre of things, of conditions that are really, there's a lot of actually good data to support their use. And some of those are neurologic, actually. And so we're seeing a lot more work being done in patients post-stroke, in patients with traumatic brain injury, in patients with Alzheimer's, with patients with Parkinson's disease, patients that have mild cognitive impairment, patients with vascular dementia, especially the early stages of vascular dementia, and mild cognitive impairment, obviously an early stage of cognitive impairment in general. Patients with reflex sympathetic dystrophy, patients with multiple sclerosis, patients that are looking just to optimize their cognitive wellness. And their actually not even just their cognitive wellness, but also their cardiovascular wellness. Because we do know that some of the ways hyperbaric therapy works really are universal, right? I talked about reversing hypoxia or low oxygen states, decreasing inflammation, and fighting infection. And really what happens, that's a short-term response, actually, with hyperbaric therapy. Over the long term, what hyperbaric therapy does is actually revitalize tissue. It actually allows the bone marrow, which is in our bones, to release more stem cells. It allows the neurologic tissue to release more neurologic stem cells, and gets those cells to areas of injury, degeneration, or inflammation, and helps regenerate that tissue. And as a result of that, it also, in addition to that, it also regrows blood vessels. So in areas that have been injured, new blood vessels are formed, new connective tissue and new supporting tissue is also recreated or revitalized in those areas to help really revitalize the tissue in entirety.
Wow. So it's releasing stem cells, it's potentially regrowing blood vessels, it's reducing inflammation. So sort of a multitude of mechanisms on how just delivering high pressure oxygen, sort of super concentrated megadoses of oxygen are purported to really help people. Fascinating.
And it's super simple, just oxygen and pressure. That's why I liked it.
Right. It's a really simple design, exactly. But before we move further, can you share any sort of stories, anecdotes, maybe not part of research, but just things that you've seen, especially with people with Alzheimer's or cognitive impairment, sort of things you've seen, the types of improvements you've seen. I think sometimes in the news media, social media, people selling things, there is an overstatement of benefit. What can people sort of realistically expect, especially in the domain of cognitive impairment and Alzheimer's, if they commit to a series of treatments with hyperbaric oxygen? What's a reasonable expectation, and what have you seen?
Well, it's a really good question, Nate. I think it's extremely important to always put things in perspective. And hyperbaric therapy is a great technology. It's a great therapy, but it should almost never be used in a silo. And what I mean by that is that really the best improvements that I've seen in patients have been those that have used a comprehensive approach to their wellness and to their recovery or to their condition. And so what I've seen is that patients that have just done hyperbaric therapy have significant improvement in cognitive wellness. So for example, in patients with mild Alzheimer's, mild cognitive impairment, patients with vascular dementia, but mild on the spectrum of mild, they do well. They don't have an extreme improvement. They have a significant improvement. They feel better. They're thinking better. Their memory's better. Their executive function is better. And by executive function, I just mean their ability to retain memories, their ability to hold things in their mind. But where I've seen the real power of hyperbaric therapy is in an integrative approach. And that's where I really specialize my work, Nate. So when somebody calls me or goes to one of our clinics, either at Hyperbaric Medical Solutions or in some of our San Francisco locations, I get these questions a lot. I can think of somebody the other day. They say, they said to me, they said, Dr. Scott, I have Alzheimer's. It's early. I just got diagnosed. I really want to do hyperbaric therapy to get me better. And I say, that's great. I'm here for you. But the first thing we need to do is take a functional medicine approach to this, take an integrative approach and look at your genetics, look at your inflammatory markers, look at your microbiome, look at your hormones even, and look at other pieces of the puzzle and optimize those first. And so something like the Dale Bresden protocol, right? Or things like that are extremely important because I've had some dramatic success in patients. I could think of one particular patient. He was a 60-year-old guy, and I had the same discussion with him, and he was just all for it. I told him about Dale's work, and he went and dove into it. He did the whole program, and then he did hyperbaric therapy too. And I think in the setting of Alzheimer's especially, the way hyperbaric therapy works, I think primarily is by an anti-inflammatory effect. So in the sense of allowing the body to heal itself by decreasing the overall inflammation in the body. And by doing that, you're allowing those neurons to regenerate themselves. And you're also giving them enough oxygen, I think, to revitalize that area, and then also populating it with stem cells to help regenerate and renew and cause neuroplasticity, or the ability of the body to regain function. So, and I saw this in this gentleman, and it kind of swept me off my feet. It made me more smitten.
Yeah, I was thinking that too. You were smitten. He smote you.
I was smitten because, and I've had experiences like that with patients with traumatic brain injury, patients with Lyme disease, patients with vascular dementia, because even though we think of vascular dementia as something that's just sort of vascular, there's so much going on. When you have low oxygen states, it's not just about regrowing blood vessels, but it's also about repopulating with stem cells and new blood vessels and all the other aspects of nutrition, and looking at their vitamin levels and cofactors and their, what we call the metabolome, or how the cell is actually functioning. And so you look at all that, and this is where I rely on amazing doctors like you, Nate, who do that work. And then working in conjunction is so powerful. I almost wanted to curse, but so powerful.
I am glad you mentioned that, this sort of integrative or sort of multi-domain or functional approach, because our belief really is that Alzheimer's disease is more of a syndrome. In other words, it's several diseases that appear like one disease, but two recognized causes or contributors to this syndrome we call Alzheimer's are vascular or blood flow issues, like you just mentioned, as well as concussions and traumatic brain injuries. And along those lines of the sort of synergistic effects, I've heard you talk publicly about the synergies between ketones and potentially a ketogenic diet. Can you briefly explain what you mean when you're talking about the synergy between ketones or the reliance of the body on ketones and fats over glucose, and how it might be synergistic with hyperbaric oxygen therapy and what you've seen in people that you're treating?
There's so much that's going on in this field, and it's just so exciting. I think one of the first things I learned about the ketogenic diet was its potential synergy in cancer care, and also cancer plus hyperbaric therapy plus the ketogenic diet through a researcher of mine, or a researcher friend of mine. He's not mine. He doesn't belong to me. But he's Dominic D'Agostino in Florida. And some of his work really intrigued me. And then talking to him more and learning that what happens when somebody's ketogenic actually is not only do they protect normal cells because they decrease oxidative stress overall, and normal cells, not cancerous cells, but normal cells for the most part, are protected and can use ketones very easily to make energy. It's also more efficient to use ketones as energy. And not only is it more efficient, but it doesn't seem to get worse over time, as opposed to glucose metabolism, or the ability to use glucose to make energy does seem to degenerate over time in all of us. And this really makes a lot of evolutionary sense, right? Because you think about 3 days without food when we were 20, 30,000 years ago, if you believe that, and looking for that meal or we were going to die, you didn't want a body that would just falter or just fall over, but you wanted to have extra clarity. You wanted to have extra focus. to actually hunt that animal and kill it. And as a corollary to that, what Dom and others are finding is that you're actually increasing vascular flow when you're ketogenic. And so what I've seen in patients with Alzheimer's and patients with mild cognitive impairment, vascular dementia, and traumatic brain injury, and actually patients post-stroke, is that if I can convince patients using some of this information to even try some ketone supplements, so not even go ketogenic right away, but actually give them some ketone supplements, and then put them in a hyperbaric chamber or give them a dive, as we call it, or a dive under pressure, their brains are going to almost immediately feel better. And one of the things that I know it's difficult in functional medicine, what you do, Nate, is similar to what I do in hyperbaric medicine, is that there aren't often instantaneous results. So people have to wait, right? They don't get that instant gratification. But what I have found, I take, something that makes it easy, right? Whatever it is, taking drugs and the Band-Aids, and that's conventional medicine, right? Because it makes people feel better faster. And there's a use for that, right? There's a need for acute care. There's a need for hospitalized care. I mean, like you said in the beginning, I still work in a hospital sometimes, and that's okay. We need that. But at the same time, the body has this amazing ability to heal itself. It just takes time, and it takes change on the cellular level that comes from behavior change most of the time. So, but to do that in functional medicine and even in a hyperbaric chamber often takes time. Now, a little bit of a shortcut or a hack, as it were, is to give somebody some ketones before they go into the chamber, and then all of a sudden they feel like a new person when they get out. And so I found that that's a good way for people to not only feel better, and actually that's even something that they can do on their own if they start at least maybe with exogenous ketones, but then it's probably better. We know it's likely better to be following the diet itself, or at least a modified Atkins and maybe some supplementation along the way. But if they can do that over the long term and they can feel those effects instantaneously, then there's a lot of power in that. So I've seen that time and time again, where I encourage people, maybe it's not supplemental ketones, maybe it's just medium chain triglycerides or caprylic acid or a C8 derivative of MCT. So if I can encourage somebody to try that on the initial protocol, the first couple dives, for the first couple hyperbaric treatments, I've seen some dramatically improved people very, very quickly. Now, I always tell them too, look, you might feel really good the first couple treatments, and that's a good sign, but it still takes a while for your body to actually have the long-term changes that are more sustainable, right? So it's the epigenetics of the whole thing. And what I mean by epigenetics is that your DNA doesn't change, right? We all know this. I'm sure you maybe even discussed this on early podcasts. But what does change is the environment that allows that DNA to manifest in different ways. And how hyperbaric therapy works is actually through epigenetic changes on the DNA. I've spoken about reversing hypoxia, inflammation, decreasing, and fighting bugs, but it's all doing that, except for maybe the infection part, on the DNA level, really, and causing DNA epigenetic changes that will allow the body to actually have improvements over time, to regenerate these blood vessels, to deliver stem cells to areas that need them, to rev up and improve mitochondrial function, and to heal wounds, no matter where they are. So it's really about this universal process in functional medicine, as we discussed, integrative therapies, where we're looking at this comprehensive approach. And ketones are a very good way of restoring some of the efficiency of our brain chemistry. And so it's often one that I discuss with patients. And there's other technologies that I discuss with them too, trying to find ways to engage people in the process. And people like gadgets and gizmos and things that they can take that are, quote unquote, easy, right? The work that we do, especially functional medicine, for goodness sake, is hard. It's a slog, and people have to be invested. So if you can give them these little glimmers of hope along the way, then I think it's extremely powerful.
I know you haven't had any there's not any publications in humans, and there's some in mice at this point. And I make an important distinction for our listeners: that Alzheimer's in mice is very different than Alzheimer's in a person. Typically, the mice, they can design the mice to develop Alzheimer's. Theoretically, a human being with a genetic predisposition is designed a priori to develop Alzheimer's. But like you just said, Scott, it's all of the environmental factors that were still being clarified, but sort of not enough oxygen, poor diet, not enough exercise, several chemicals, infections that seem to contribute to this sort of syndrome that we call Alzheimer's. One feature of those is this mitochondrial mutations. So those are a common feature of aging in general, and certainly of Alzheimer's. And what I'm fascinated by is that you begin to see, like if you look in lumbar punctures, you'll see certain markers for oxidative stress and mitochondrial stress is some of the early changes in Alzheimer's, perhaps even before some people develop real symptoms, meaning they start to feel forgetful or have trouble organizing, or they have trouble at work, or things are taking them, things that took them half an hour now taking them 90 minutes. Just to get organized. It's fascinating to me because you mentioned this idea of revving up the mitochondria. What's happening there? Is that an ATP story, or what's happening there in terms of revving up mitochondria?
Yeah, it's definitely a little bit of that. It's definitely actually a lot of that, increasing energy production on the mitochondrial level. It's also probably causing some hermetic stress. And that what that means is that putting a little bit of stress on the mitochondria to actually function better, in the sense of, there are good stresses for the body, right? And there are bad stresses too. Right, exactly. So so exercise is a good example. So hyperbaric therapy likely has a hormetic stress on the mitochondria itself. And there also is a mitogenesis response as well as a result of that. So increasing the mitochondrial density, the number of mitochondria in cells. And so one of the things that I get questioned about from physicians especially is that, and this is it's a reasonable line of questioning, is, well, how does hyperbaric therapy work? And we've discussed that. But one of the things that I haven't mentioned is it does work with oxidative stress. So that's something you just mentioned. And oxidative stress is classically thought of as something that's bad, right? The idea that you're putting more pressure on the body, you're putting more inflammation on the body by causing oxidative stress. But it's also, I think, under-recognized that oxidative stress is how the body works, right? We actually make oxygen radicals in a small amount in our body to allow it to function, and oxygen radicals, oxidative stress is necessary for the function of cells as it is in normal cells, and not even just in disease or mutated cells or mutated mitochondria. But the other aspect of what hyperbaric therapy does is it also causes a response, an antioxidant response at the same time. So any oxidative stress that's out of proportion to an antioxidant response is mitigated or resolved actually after about 2 to 3 hyperbaric treatments. So it is something that I do worry about in patients that have a high oxidative stress burden to start off with. And what I mean by that is patients that have a lot of inflammation ongoing. So in those patients, in that patient cohort, I'm very cognizant, I'm very aware that I need to supplement with antioxidants before starting hyperbaric therapy, knowing that they are at higher risk for just having more of an oxidative response, more inflammation in general.
Okay, I understand. Very interesting. It kind of leads me into another area about the overproduction of oxygen radicals, and if there's any truth to that. On the other side, this idea that concussions or vascular dementia or strokes or elevated blood pressure, having hypertension or elevated blood pressure for too long, one can develop a sort of leaky brain, a broken blood-brain barrier, the barrier that separates. The brain really protects the brain from a lot of other insults that kind of run around the rest of the body, infections, metals, things like that. And is there any literature on, because one of the things our group is really surfing around for is there anything that has any evidence at all for addressing issues around a permeability of the blood-brain barrier, or can it make it worse in the case of hyperbaric oxygen?
That's a good question. In fact, something just came across my desk like about 10, 15 minutes before we started, looking at that very question. How does the blood-brain barrier, how is it affected by a hyperbaric stimulus? And it seems because of its anti-inflammatory response, it's likely making the blood-brain barrier sealed better. So less permeable, I should say. So less permeable to the things that shouldn't get over into the brain. And one of the ways that we're looking at that is through this is some new testing, and then I'm working on this with a couple places near me, but looking at microbiome testing and looking at other inflammatory markers as well. And as we know that the blood-brain barrier is not as sealed as we once thought it was. Most of us in medical school, and I didn't go to medical school that long ago, thought that this blood-brain barrier was this very, very sealed membrane that nothing got through. But we know now that bacteria can get through pretty easily in some cases, right? But a lot of it probably has to do with inflammation at baseline. So one of the things that I see often, in fact, I saw a girl today, she's 14 years old, had some abdominal issues for a lot of her life, like a lot of GI problems when she hit puberty. And then she just hit her head like in a hotel room or something, and basically has had headaches for a year and a half and still has all these GI symptoms. So what did we do? We started with her gut, right? We started getting her gut in order, and now her symptoms are getting better, right? Without even starting hyperbaric therapy yet. As soon as we started healing her gut, her brain is functioning better. So, and I've seen it in other patients where we've started this process and then we add on hyperbaric therapy and they get better even at a more rapid clip. And I think a lot of that has to do with the blood-brain barrier and helping with that permeability and the inflammatory cascades that are allowing it to stay probably too permeable. And with this one girl that I was mentioning, something that's been long-standing, and then she had this threshold event, this brain injury, and then that barrier was interrupted even further. That bacteria transported across, or it was already there, and then it would just got to a higher load, a higher threshold, and now this brain injury is not really the issue as much as it is a gut bacteria issue and the blood-brain barrier being too permeable. So it's definitely a really interesting area of research, and there's not much in the hyperbaric field yet, but I do see that as something that more of the bench researchers and my colleagues are looking at for sure.
Yeah, there's a lot of people looking at sort of the microbiome in the brain, the microbiome in the sort of rhinonasal passageway, which of course is kind of the port of entry in through the nose and the cribriform plate into the hippocampus, which of course is highly implicated in Alzheimer's disease and is a major biomarker on imaging and like MRIs, and we've certainly talked about that on this show. So that's I guess is a remains to be seen, but we'll have to follow that closely.
Yeah, I have a colleague actually that's doing hyperbaric medicine in Colorado, and that he's combining hyperbaric therapy with intranasal PRP and stem cells, using that sphenoid sinus, what's in your nose, the cribriform plate, to actually diffuse over those things to help with healing. And we're looking at that. You actually see some low-level light therapy devices now, which I often recommend to patients. Yep, Vilite and others like it, that you can stick into the nose and actually exploit that same passageway. And so I think that one of the things that I have a lot of passion behind is already discussed is the integration of these therapies together, right? So if hyperbaric therapy is a great synergizer, functional medicine is a great foundation, then you have other people that are involved in the process, other practitioners, other technologies, one of them being low-level light therapy. Another one that I recommend a lot is neurofeedback. If for patients with brain injuries or other mechanical injuries in the past, like concussions, brain injuries obviously are concussions. They're kind of one and the same. But looking at patients that would actually benefit from chiropractic care, osteopathic care, other cranial sacral work, it's extremely important. And I think if you ever go to a doctor that says, I'm going to just go out on a limb here, but I'm going to say this. If you ever go to a doctor that says that my therapy is the only therapy that you need and nothing else that you need will work,
run the other way.
Please run. Yeah. Yes. Because, is that right?
My wife was just saying the same thing.
I think you and I, Nate, both We both know doctors like
exact
this.
same way.
And I don't think it often comes from a bad place. I think it comes from a misguided place in the sense that we're all individuals. And I think that's what we're learning. And I think that's what functional medicine is all about, is trying to treat the individual. And hyperbaric medicine, hyperbaric therapy is becoming more dynamic. It's becoming less of a hammer and a nail kind of device. It's becoming more of a nuanced therapy. And that's an interesting point in itself. We don't treat everybody in the chamber the same way. We, at least myself and my colleagues in the clinics that I work with, it's about understanding the patient, understanding their goals. If it's as simple as recovering from a hard workout, it's going to be a different protocol than treating somebody with mild cognitive impairment or Alzheimer's disease. And so there's lots of nuance. And I think that's really where the challenge is as a physician or as a patient, is that I think that there needs to be a team effort to wade through all of that nuance and be very forthright with patients in saying when we don't know the answer. And I think it's a brave, and I think the doctors that you want to hear say that they don't know the answers, because I think if somebody never says I don't know in a conversation, and you're asking the right questions, then I think there's a problem, because I know I don't know all the answers. And that's why I've created networks of individuals like Nate, like you, and others that can help solve or help address questions that I don't know the answer to. So that was my soapbox for the podcast. But I think it's important, because I know that patients are going to be listening, is that when they look for doctors and therapies, that they ask the questions about what else can help me. What do you think about this or this? And if you start getting the answers, oh, none of that stuff is needed, all you need is this, then just be wary. That's all. And I often say the same thing with hyperbaric medicine too. Like I've mentioned, it's a synergistic treatment. Very rarely do I recommend it in a silo by itself.
Mm-hmm. So speaking of how you do hyperbaric oxygen. So I've also heard you, so there's the traditional chambers, and maybe you can describe that a little bit. And I've also heard you describe something called mild HBOT, mild hyperbaric oxygen therapy, or these soft chambers, which may work in the neurocognitive realm. Can you distinguish between what like real or true hyperbaric oxygen chamber is and a mild or soft chamber? Because these seem to be popping up all over the place because they're sort of easier, and maybe you don't need the licensure or something like that. Like, what is this mild HBOT?
Yeah, that's a good distinction. So there's different types of hyperbaric chambers. Classically, the definition of hyperbaric oxygen therapy is 100% oxygen under increased atmospheric pressure. And typically that is a pressure greater than 1.3 atmospheres, which is about 15 feet of seawater pressure equivalent. And to take one little side bar there, just so we all understand, when you're underwater, all of the water above you is exerting a pressure on you. Okay, but you don't feel that pressure because you're weightless in the water. And what we're doing in a hyperbaric chamber is actually simulating that pressure that you would feel if you were underwater. So I don't know if I made that exactly clear, so I just wanted to do that. So when you're looking at the different types of chambers, there are soft hyperbaric chambers or mild HBOT. There is hard hyperbaric chambers that are broken up into two categories. The first category is called a monoplace hard hyperbaric chamber. And then the second category is something called a multiplace hyperbaric chamber. So to start off, the multiplace chambers are the ones that go to the deepest pressures, and they can treat multiple people at the same time. So these are the ones that you'll find in academic hospitals. These are the ones that you'll find in diving meccas like the Great Barrier Reef, the Channel Islands.
They look like saunas with a bunch of people with bags over their heads, those types of places?
Right. So they'll pressurize the chamber, and then the patients inside will wear hoods that give them 100% oxygen to breathe. And the monoplace chamber is a hard hyperbaric chamber that is for one person. Basically the same. It looks like a little capsule, right? And then they can be with little portholes like you're on a ship, or they can be completely translucent using a hard acrylic plastic as the shell. depending on the model and the make and all those kinds of things. And those chambers are typically pressurized with 100% oxygen. So you're breathing normally, but the entire environment around you in the chamber has 100% oxygen. Although sometimes those chambers are pressurized with just air, which has 21% oxygen, as I mentioned earlier, and you wear a hood, just like you would in the multi-place chambers. Now, the monoplace chambers go to about 3 atmospheres absolute of pressure, which is the equivalent of about 66 feet of seawater. So that leads me to the soft hyperbaric chamber. So the soft hyperbaric chambers go to 1.3 atmospheres, and that's about 15 feet of seawater equivalent. They're pressurized with air, and some of these chambers will have as an added piece or an added component an oxygen concentrator that is threaded through the chamber, and you breathe with a mask, etc. So the soft chambers have never really been used in clinical studies. Now, that being said, they are FDA approved for something called acute mountain sickness, which is when you go up
an inflatable rocket, it's something you see at a circuit or you rent for your kid's birthday. You know what I mean? It's like just these very soft inflatable things.
Yeah, they fold up, right? They don't have a whole lot of structure to them unless you fill them up with compressed air. And they're usually made of a polyurethane or a nylon material. And the hard chambers are either made of metal or hard acrylic glass. So it's a different type of material, like you were mentioning, Nate, exactly. And so the soft chambers, like I mentioned, are approved for acute mountain sickness, which is if you go up in altitude, like on a mountain, and you get altitude sickness, you can go into one of these things and you can get better faster. But there probably is a use for them in patients with neurocognitive conditions. And the reason for that is funny in some ways. The placebo or the sham or the people in a lot of the clinical studies that were given hyperbaric therapy. So the example here is in patients with traumatic brain injury. They looked at 2 groups. One group was getting 2.4 atmospheres of pressure, which is high pressure. You can only get in a hard chamber. And they compared that to patients that got 1.3 of compressed air in a hard chamber. But that's the exact same thing that you can get in a soft chamber, okay? They compared those 2 groups, the group that got 1.3 with compressed air versus 2.4 at 100% oxygen, and everybody got better, right? And so the conclusion to the study was that hyperbaric therapy was not effective. It was all a placebo response, right?
On the other.
Right, because what they failed to elucidate in their discussion is that when you compress even room air, which has 21% oxygen, to 1.3 atmospheres, you actually increase the amount of oxygen in circulation by about 45%. So not a dramatic response, but that's not inert. That's not a placebo. You are increasing the amount of oxygen in circulation by 45%, which, as opposed to 2.4 atmospheres at 100% oxygen, which is 1,200%, is definitely a smaller amount, but it's still significant. And in fact, what we've noted after that study was done in more recent studies is that patients at 1.5 atmospheres at 100% oxygen do better than patients at 2.4 atmospheres, and also likely do better than those that are getting treated at 1.3 with just compressed air.
So lower pressure, compressed oxygen, but higher percentage oxygen. Okay.
Right. Yeah. Just to kind of make that a little bit clearer, because I know that's a lot of words that nobody's heard before, is that if you have somebody that gets to a soft chamber, for example, and gets 1.3 atmospheres of pressure, and these are the bag chambers, they will not get as better, or they won't improve as much as somebody getting 1.5 atmospheres in a hard chamber. However, what I've noted in my own clinical experience is that patients getting 1.3 in the soft bags do improve. And there likely is a significant potential for these to be used in long-term maintenance of patients that have neurocognitive conditions. So, for example, what I often recommend is patients get their treatment in a hard chamber, if at all possible, for their first protocol. And then over the long term, they maintain those effects, especially in patients with neurocognitive illness. They maintain those effects potentially in a soft chamber.
Okay, so why would so there's no data on that. We understand, like, that's not been experimental. That's based on your experience, and I appreciate you saying that. So just to clarify one other thing, and we'll get into, like, a treatment course is usually, like, it's not a simple thing. It's like a 20 to 40 sessions, right? These are like hour-long sessions or something.
Right. So there's two ways to think about hyperbaric therapy. There's the acute stimulus of hyperbaric therapy, and there's the more long-term benefit of it for a protocol. So after about 3 treatments, you've decreased inflammation, you've reversed acute hypoxia or acute low oxygen states, and you've fought off a couple bugs or a lot of bugs, depending on the situation. And so the more acute the injury, the more acute the injury, the less hyperbaric therapy is needed to actually get a significant effect. So in patients that have had a surgery or a traumatic injury, we often recommend just 3 to 5 hyperbaric sessions. Now, if you have a more long-standing illness or condition, like an autoimmune disease, like Alzheimer's, like Lyme, or even a traumatic brain injury, post-concussive syndrome, that's been ongoing for more than 3 months or so, then you need the long-term effects of hyperbaric therapy to really see the benefits. And that takes a protocol. And those protocols usually are between 20 and 40 hyperbaric sessions. Those sessions are done successively. So they're not just done once a week. They're done Monday through Friday with the weekends off for the entirety of the protocol.
That's a big commitment.
It is a big commitment. Yeah. It's a big investment in your health. And that's how I describe it to patients, because hyperbaric therapy works on the DNA level, like we talked about. And to have that epigenetic effect, it takes the oxygen stimulus on a daily basis to really do it. And that's been shown in a number of clinical trials. The effect of hyperbaric therapy is with that successive treatment. And so in conditions, we're often talking about 20, 40, sometimes 80 or even 120 hyperbaric sessions that are used. And though when we get to after about 40 or 60, people do take breaks. And we also know that people have lives. So we have to work on this. And one of the things we can do for neurologic protocols is even do twice-a-day therapy sessions with a 4-hour break to try to compact it in if needed as well.
And how long is each session typically?
Each session is between 60 and 90 minutes at pressure. And so what that means is that there's a time at the beginning of your session and at the end of your session where you're getting pressurized to the level of oxygen and the level of pressure that we'd like you to be. And then at the end, you have to kind of come out or go back to the surface. It's kind of like, you can think about it as diving under the water and getting to 25 feet of seawater. It takes time to get there, and then it takes time to get back. But I should also be clear that there's no water involved in hyperbaric therapy. It's just simulating the pressure. So you're not swimming in there or anything. No bathing suits are needed or anything.
Right. What can someone expect to pay for each sort of treatment?
Right. So if it's an FDA approved condition, insurance covers it. So it's covered by commercial insurance. It's covered by Medicare. It's covered by all the state Medi-Cal plans, unless something happens. Although I don't think it will now, right? Because the new Affordable Care Act issue is not happening. I don't know. But in any respect, it is covered by the Medi-Cal, Medicaid, the state Medicaid insurance plans as well. Now, right. So in the cases of the off-label, which Alzheimer's and the mild cognitive impairment, vascular dementia, post-stroke, traumatic brain injury, all of the neurocognitive indications for hyperbaric therapy can fall at the moment. That's an out-of-pocket cost. So if you have a traumatic brain injury, for example, there are some organizations that I am affiliated with that do sponsor patients and help get free hyperbaric care. Hyperbaric Medical Solutions in New York, for example, they have a program for veterans that are from the wars in Iraq and Afghanistan, and they will treat patients for free. But if you don't fall under some of these categories, it is an out-of-pocket cost. And that cost ranges from, on the hard to hyperbaric chamber side of things, from about $120 a session to $450 $50 a session, depending on where you are in the country. So as you can imagine, if you're in Texas where there's no regulations versus if you're in New York City or San Francisco with lots of regulations and lots of cost associated with the practice of hyperbaric medicine, it's going to change what the cost is. But the cost is significant. That is true. But the potential for improvement, especially in the comprehensive way we're discussing, is so high. The potential is there's so much potential there that I also understand that it's a difficult thing for patients to do. And so when I often have these conversations, I talk about cost, I talk about the investment, and we also talk about other things that you can do if hyperbaric therapy is not affordable for you at the moment, right? I mean, there's things like even getting people to sponsor you, like going to like a GoFundMe type of page, and we have patients that do that. But there's also other modalities out there that could potentially be helpful. And we talk about diet and behavior change being the things that are free, right?
Absolutely. But hopefully those people know those things before they come to you based on what you've laid out here. You know what I'm saying, Scott?
I always talk about those things if people want things that are free. Well, it's usually a comprehensive discussion, Nate, where we're like, this is hyperbaric therapy. These are all the things that you can do. These are some of the costs involved. This is how you can get started. This is where your most power is. This is your most bang for your buck. And then have it be a conversation, right? Like how do you want to approach this? And of course, you don't want to overwhelm people. And that's something that functional doctors have to be very careful of, as you know. But at the same time, it's you want to give people options. And so I'm very much of the perspective and the mindset that as a patient, and I've been a patient before, I mean, you want to be empowered. So and have a discussion with your physicians. And so that's how I approach it.
Yeah. Just a couple more things. I wanted to really, can anyone do hyperbaric oxygen therapy, or is there like a contraindication? I mean, reason somebody couldn't do it?
Yeah. So it is an FDA approved therapy. So what I mean by that is that it does require a prescription for you to get into a hyperbaric chamber. So that's another thing to point out. If anybody ever says to you, you don't need a prescription, you can just go into the chamber. Please don't do that, because there are a couple things, they're rare, but there are things that we do think about when somebody goes into a chamber that are important. I mean, the one of the things that that's a very simple thing to discuss is that patients will feel pressure in their ears, right? So if you're in a pressurized environment, you have to make sure that your ears can tolerate it. And in a soft chamber, it's not a problem. Even in the hard chambers, it's usually not a problem. But if you have an infection, if you have an upper respiratory infection, if you have colds, if you have sinus problems, it can all make it difficult for you to clear your ears. And if you can't clear your ears, what can happen is that pressure can build up and can cause actually tympanic membrane or eardrum damage. So it's important to have that discussion with a physician or a healthcare practitioner, because I believe, at least on the soft chamber side, the chiropractors can prescribe soft hyperbaric therapy depending on their licensure per state. But what I often do in my own practice is I consult with patients across the country, across the world even, and then I will help coordinate with their local facility to make sure that they get protocols that I think would be best for their particular conditions. But it's important that you have the discussion not only about ears, but also about some of the medical issues that patients may have that would preclude them from going into a chamber. Now, one of the more common ones is pregnancy. You're not supposed to go in a hyperbaric chamber if you're pregnant. That being said,
what about asthma and COPD and things like that?
Yeah, so if you have asthma, but it's mild and you don't have air trapping, if it's well controlled, then it shouldn't be a problem. If you have mild COPD that's not oxygen dependent and you don't have what's called a restrictive defect, which means that you don't have a difficulty getting oxygen to your body, then it shouldn't be a problem. If you have a history of air pockets in your lungs, those can be dangerous. Air pockets are something called bullous lung disease. It happens in patients with COPD. What happens with a bubble under pressure is that that bubble gets smaller under pressure, but when you take that pressure away, it gets larger again. And when that bubble gets larger, it can pop and it cause something called a pneumothorax. So it's something that we're very cognizant of. And so in patients that have had a smoking history, I recommend a chest x-ray within the last year, if possible, especially if it's a recent quitting of smoking. If they have had coronary disease And if they have any issues with heart function, we also want to make sure that their ejection fraction is greater than 35%, because hyperbaric therapy will also put a little bit of pressure on the vessels around the heart, increasing something called afterload. So but at the low pressures or at the milder hyperbaric pressures, I've never seen a problem. But at the deeper pressures, I have seen people go into cardiac or pulmonary edema, basically, or increased fluid in their lungs if we're not careful. So in patients that are extremely old, like in 85, 90-year-olds, we do put them in the chamber, but we're very careful, even if they have normal heart function, because when you're 85 or 90, you don't have a normal heart exactly anymore. But again, this is why it's important to talk to somebody that knows what they're doing and not somebody that says, yeah, here's a prescription, go into the chamber, because there's just so many nuances to this. And that's really where I do most of my heavy lifting, is the nuances. So we talked about COPD, asthma, talked about heart disease. If patients are really claustrophobic, it can be a problem because you are sealed in a chamber. But for the most part, that's very rare for it to have a problem. Patients that have high fevers. So high fevers, and then what that leads to potentially is something called seizures. So in a high oxygen environment, you are at a higher risk for having oxygen seizures. And they're very rare. And I've never seen it at the lower pressures. And at the higher pressures, we have ways of mitigating it in the chamber to prevent it from happening in somebody that may be at risk. And those people that are at risk are people that have a history of brain cancer, brain occupying lesions, if they had a previous stroke or traumatic brain injury. Their brains are just a little more sensitive to oxygen. So it's important that we understand that and we mitigate for it if needed. But it's so rare, Nate. I just have to kind of put this out there that hyperbaric therapy is extremely safe. It's safer than like taking a Tylenol, for goodness sake. So in the sense that the side effects are rare, they're easily remedied if they do happen for the most part, even the more severe ones, to be honest. So, but I think it's also important to have this discussion with people. And that's why, I just had a conversation with somebody today before we got on the phone about hyperbaric therapy, and he's looking to do it, and he wants to get a soft chamber. So these are the mild chambers. And I said to him, look, it's better to go to a hard chamber. I gave him my whole spiel about hard chambers are better because they're better regulated. That's another piece in the hard chamber, soft chamber market. The hard chambers are better regulated. They're better supervised. You're going to people that know what they're doing, versus the soft chambers are at people's homes and are less supervised, and there's more danger in that. So, but if you don't have a choice, if you're in a place that doesn't have hard hyperbaric therapy available, then yeah, get a soft chamber and I can help you through it. And he's like, oh, I have my dad, I'm going to put him in there. My friend, I'm going to put him in there. I'm like, no, don't do that. Don't do that, because they need to talk to me. We need to have a discussion. But that's what happens in these soft chambers. And that's what scares me, is that they're just unregulated. People are just putting their friends and their family members in there, their pets and everybody else. And look, they're really overall safe, but at the same time, the goals should be understood and there should be a comprehensive discussion.
Not like eating a piece of broccoli.
Yes. Yeah. There's some jalapeno peppers that are really, really fine inside those broccolis that you just haven't seen. You want to get all spices.
Yeah, Scott, this is such good information. If someone especially with cognitive impairment, trying to prevent Alzheimer's or dealing with early Alzheimer's, has questions for you or questions about this topic, what is a way that they can learn more?
Well, there's a number of different ways. I think that probably the simplest way is to go to my website. It's www.integrativehbot.com. The word integrative followed by HBOT.com. Or you could just Google my name, Scott Sherr, Sherr, or Scott Sherr, or Scott Shear, or whatever else pronunciation you want to use for my last name. I've seen it all. Scott Shore, there's another one, but Sherr. And what I do is I have a pretty good website showing some of the work that I've done with podcasts and other blogs and other types of media to discuss hyperbaric therapy. My passion is to speak to people like you, Nate, who are looking at things in a comprehensive way and really just trying to help people, right? I think I mentioned this briefly earlier, but I really don't care if people get hyperbaric therapy or not in the big sense of it. It's more that they're engaging in their health and really working not only for themselves, but for others too. And so if hyperbaric therapy is not right for them, that's okay. They now know more about hyperbaric therapy. Maybe one of their family members could benefit from it, or they become an evangelist in their own right because they got treated with Nate, and now they're a functional medicine expert, and they listen to all this other great work that's being done. That's all good with me. So I've positioned myself in a way that hyperbaric therapy is what I do, but I do it in an integrative way, and my goal is to engage people in that respect, and to not be a one trick pony, I guess they call it, right?
Totally understand. Scott, thank you so much for your time. Thank you so much for being here. We really appreciate it.
Thanks for what you're doing, Nate. I appreciate your time too.
So that's our episode. I hope you guys got something out of that. Check the show notes out on iTunes or on our website where we've summarized the key points. If you have questions or comments or just want to connect, please check us out on our Facebook page. Or if you're old-fashioned like me, Google Evolving Past Alzheimer's Podcast, and you'll find us that way. Finally, if you find the information here valuable, please consider giving us a 5-star rating on iTunes and leaving comments in the comments section. It will really help us bring this message to as many people as we can. Thanks, and talk to you next time.